So today we are honoured with your presence, Dr. Phil Parker, who is a finalist in the healthcare category for the NLP Awards, which is awesome. I've been privileged to be reading your nominations, or the nominations that were put in on your behalf, and it's some incredibly moving statements within your nomination. And I suppose to start off with, I'd really just like to know a bit more about the work that you do and maybe why you think these people have nominated you.
Well, first of all, I didn't even know I was nominated. I didn't know people have been nominating me, so it's very nice. So my work is I spend a lot of my time working in health and using the skills of NLP and other skills as well, because I'm also an osteopath, to help people to discover that they have more possibility, more chance and hope of making change than they might have imagined. And I work in a number of different fields. So I work quite a lot with doctors and healthcare professionals, looking at some of the stuff we know, but they don't know about, like the importance of language and how you speak to people, not just being nice to them, but the impact of words on neurology and physiology.
Yeah.
And what's interesting is that now the research is actually catching up with what we've been doing for decades, which is starting to recognize that these things are important. It's not just irrelevant what words are said in a consultation. So I do quite a lot of work there. I work a lot with people who've got chronic illness, and particularly, so chronic just means long-term, for a long time, and particularly people who've been told there's nothing that can be done for you. Where they've run out of options, they've tried everything and nothing's really worked for them. And we work a lot with that, so kind of impossible conditions. So long-term depression, anxiety, OCD, eating disorders, and also a lot of physical stuff like multiple sclerosis and Parkinson's, and people with chronic fatigue, fibromyalgia, chronic pain. So a range of stuff in that arena, helping people to rediscover that they can make change. And a lot of our work is seeing it not as treatment, but as training, that we need to train these people to learn how to use their brains differently, that can have an effect on their body. And then the third thing I do, so I do a lot of research. So I've just finished my PhD a year or so ago. And in that, I was looking at taking those skills that we'd used with people with stuck chronic health problems. What tends to happen is people come along and they say, "You've helped my friend who's got this, can you help with this?" And we'll say, we have no idea, we haven't worked with this yet, but we'll be interested to find out. So we do some studies in that. And one of the groups that came to see me was people who had addictions, who said, "You work with things that just keep on coming back again and again, and addictions is one of those things. The stats are very poor for addiction treatment, really, really, really low. Most people don't get out of the treatment system."
Yeah.
So we started applying the lightning process, NLP, to addictions, and that was the basis of my PhD, working at can a new approach help an old problem that there are no solutions for. And the results of the RCT were that when they used this thing called the rediscovery process, they got much better results than if they had the usual treatment, statistically significant. So working in all those areas, so people live, street drugs, people living under bridges in cardboard boxes, people with health problems, working with researchers, all that kind of stuff. So that's what we spend a lot of our time playing with.
And I mean, as I said, I've been honoured to read the nominations that have been put in some detail, and just reading some of this information that you've helped thousands of people. You've helped over 25,000 people with these chronic conditions. I mean, that's incredible. And reading about, because you're training people to support these people as well, but you train them all yourself, is that right?
Yeah, that's right. Yeah, so one of and this really comes from our NLP world, which is the lightning process, which is the thing that kind of a lot of this stuff is built from, which is fundamentally built from a chunk of NLP, osteopathy, and life coaching, and a bit of positive psychology. But its core center is modeling. So I modeled people who had found themselves stuck. They really wanted to get well. They tried everything and nothing was working. and yet they had illnesses that other people had recovered from. So I did a modeling project, which was, well, what is the difference? How come, you know, you want to get well, you tried everything, it's not working for you, seeing some great people. Can we identify any patterns in this? And I started to see some interesting patterns, particularly in their language, the way they talk to themselves about their condition. A lot of stuff about beliefs, a lot about negative language, but also about passiveness within language. And so I created this model of then, so what would need to happen in order to help people to adopt the skills of getting well. And that became the lightning process. But then, of course, because we're NLP trained, I was able to kind of go, well, what am I doing when I'm working with these people so that I could teach it well enough to other people so that they can reproduce the results. And currently I'm the trainer because I enjoy training. There will be a time, of course, when we need to get more people in, when I'm, you know, sitting on a sun lounger or a wheelchair somewhere in the dark. But yeah, at the moment I do all the training. I have a team who assist me. And one of the cool things about it is that the results that I get when I do the lightning process are replicable. So people doing right now, it's 1 o'clock. So somewhere in America, somebody will be doing the lightning process. When we go to bed, someone in New Zealand, Australia will be teaching the lightning process across the world in, I think it's something like 20 countries. There are people not just teaching the lightning process, but there are people's lives that are being transformed where they had no hope, and suddenly, you know, they realized they have power to make change to their health and their life. It's amazing.
Yeah, absolutely. And I'd love to share with you some of the comments that are on the nominations. There's things like, he deserves to be recognised for the gift he has given to thousands of people. Phil Parker's lightning process has helped thousands of people suffering from a wide range of illnesses: chronic fatigue, ME, fibromyalgia, depression, anxiety, burnout, autoimmune diseases, chronic pain. I mean, that says what you do. But I think the sort of the key things when people are saying, you've changed the lives of thousands of people for the better, and you're a true pioneer in the field of NLP and health. And how does that make you feel?
It's good. It's nice to hear that because one of the interesting things again about, you know, particularly lockdown, but just because I do a lot of the training, I don't actually do so much the lightning process itself. So most of the lightning process is done by other people. So other people are seeing this on a daily basis. I hear about it occasionally, vicariously or secondhand. I still do trainings, but I do less of the you know, focusing on individual participants than the practitioners. So it's really nice to hear and to kind of remember that, you know, I've always had this thing that what we should only really bother doing things that we think are important and make enough difference. You know, time is too short. We need to be focusing on what's really important. And for me, making really important, helping people to make important change, you know, which has a ripple so that they get well or happier or healthier, but you also see their families are transformed, or, you know, they tell somebody else about it and they hear about it and they go, oh, maybe I can change too. And those are such interesting moments. And I think probably everybody in NLP is fascinated by that moment of change where you see that life is going to be different as a result of that conversation or that intervention.
Absolutely. So, I mean, you know, you've obviously referred to NLP. It's an NLP award. But who or what inspired you to begin your NLP journey?
So I first heard about NLP in 1987.
Okay.
I was training as an osteopath. I was just coming to the end of my training and started to get interested in other ways of looking at things. And one of the guys I met on a course said, oh, I've heard about NLP, I think you'll like it, have a look at it. And I read some of the books and I was like, oh, this makes a huge amount of sense. That was the thing I remember. It was like, and a couple of years previous to that, as many people know, I severed my left hand and I was told I'd never be able to move my fingers again. And this was problematic because I was an osteopath and a guitar player, and that was really what I wanted to do, is to be a guitarist. And they said, you'll never be able to move your fingers. And I kept on asking lots of people and they said, no, you'll never move and you'll be left with a claw, a useless kind of, you know, thing you won't be able to do anything. You certainly won't be able to do anything fine movement with your fingers. And I thought, that's not the right answer. That's not what. So I kept on asking. Eventually I found someone who said, yes, you can. And I did recover, and I, you know, ended playing guitar with Eric Clapton and all sorts of other things. But it did start that journey of like, okay, well, what's possible then? When people say, I mean, I've always been a bit like that. Somebody says, you can't do that. I'm always like, I wonder if that's really true. And particularly in health, I start to explore that. So a lot of that, you know, then showed when I read NLP, I was like, oh, this really fits with my experience. And then as I went through the world of NLP, you know, I bumped into some amazing people like, you know, Robert Dilts, obviously, was very important. In fact, he was very important in the development of the lightning process. I was doing some training with him, you know, as a participant.
Yeah.
And I kept on, you know, in the tea breaks going, got this patient, it's not changing, you know, anything you can suggest. And he suggested some things. I've tried that. And he said, you know, do they really want to change? I was like, yeah, they really want to change. I'm sure they really want to change. So, well, you know, have a look at that. So that started it. Talking to Connie Ray Andreas was also another important conversation. I was doing a lot of work with parts, which is I love working with parts. Very good way of working with health.
Yeah. And
I was finding I'd work with people with parts, and it would go well, and then another part would pop out, another part, and it just was endless. And I said to Connie Ray, do you ever have this problem where you just get thousands of parts? And she said, no, I don't get that. I get a few, I don't get lots. Are you doing it properly? And I went through what I was doing. So no, it sounds like you're doing it right. Yeah. So I think what happened, I just got a very particular group of clients. And so parts, re-imprinting, timeline stuff was my go-to approaches, and they just weren't working. So I had to kind of go, well, if what I've got isn't working, you know, NLP presupposition, you've got to do something different. So that, again, that's where the lightning process began, was by having those conversations with those people and getting some pointers and going, okay, well, what else can we do then? How do we build out of this dead end?
And that's the beautiful thing, I think, about NLP, is that it's about applying those skills and applying that knowledge. And that's what you've so elegantly and successfully done with the lightning process, is taken that and mixed it with something else and just put all those ingredients together to create something that is making such a powerful difference. And that's just amazing, which is why you're one of the finalists. So what does it mean to you to be nominated for this award?
It's great. I mean, it's in the world that I'm in, I straddle two major worlds. One is the world of NLP and change, and all these incredible stories of people going, oh, my life's changed. And you know, every night me and my mum say our prayers, and we include Phil Parker in it, you know, amazing stories like that, because it's made such a, even though they've never met me, they've learned it from someone else. And that's lovely. And I'm also in the research world. Yeah. And in the research world, all that stuff, all those beautiful stories you just told mean nothing. It's like they don't have any value, because they, you know, they go, well, who's saying that? How do we know that's true? Where's the evidence? And we need to see the numbers and the data on this. And so it's a strange world to be in, where I'm in one part of the world, you know, the NLP world, people go, oh, I've heard of that, that works. And in another world, they go, it sounds like nonsense, because you've got to pay for it. There's no, you know, we have a developing evidence base, but we're not currently, you know, part of that machine. And so to get acknowledgement from this world is nice, because the acknowledgement is quite few and far between in the other world. You know, they see us slightly interlopers. It's changing now. We're starting to be included in research conversations, but for a long time there was a massive suspicion about NLP. There was a suspicion about anybody who wasn't a medical doctor, because I'm not a medical doctor. There was a suspicion about osteopathy, about complementary health, about grandiose claims that everyone's getting fixed, which we never say, but you know, there's this kind of assumption that anybody who isn't schooled in research will claim 100% effectiveness for everything. And so it's been a slow journey of gradual acceptance. So it's really nice to have some kind of acknowledgement of the work that not just me, but you know, the whole lightning process practitioner organization throughout the world has been doing.
Definitely. So here's a leading question. Where would you like to see NLP in the future?
For me, one of the key things for NLP, I was asked this just the other day. Someone said, I've heard about NLP, I've heard a bit about it. I've tried some stuff that really worked, but I've also found loads of stuff that's negative about it, you know, dissing it and saying it's awful, you know, what's going on? I said, well, this is the problem. NLP is a brilliant thing. It's an amazing set of skills. The question is, if somebody sees an NLP practitioner, so if you see a dentist, you know hopefully you're going to get some good dental work done, or a surgeon, or a, you know. But if you see an NLP practitioner, there's still a question. So if somebody says to me, who would you recommend? I would need to find out who that person is. I can't just go any old NLP practitioner you find in the phone book or on the internet. And that's the concern that I think many of us share, is that we have to somehow find a mechanism of being able to validate that person is a decent person to see for your experience, you know, what you need. And we're not saying all NLP has to be the same, that, you know, some people we know do it for personal development, some people do it for education, some people do it for business, but there needs to be some kind of way of recognizing this is the right person for that, and they're trained to the level they need to be, and all the other stuff. Because otherwise our reputation is only as good as what we deliver every day.
Absolutely, absolutely. So the awards are next May. They're taking place during the conference. We're still developing how that's going to happen, because it's a bit more challenging in a virtual environment. We can't do the same things that we've normally done. And we're really looking forward to you being there at the virtual awards next May. And congratulations on being a finalist in the healthcare category. Thank you very much for your time, Phil.